Hi everybody, this is just a quick video about knee pain and how you can help it yourself at home. And the reason I'm doing this video is that I had a sore knee myself for a few months and it wasn't too bad, so I wasn't too bothered about it, but I noticed every time I would go to move it would be a little bit sore in the beginning, but then it would ease off as I started to walk. But if I got up from the chair and went to move, I'd find it. And I did work on a few points, but I didn't spend too much time at it. And then it was beginning to get a bit annoying, so I decided to look into it, and I checked different muscles of the knee, and I found that one of them, the gracilis, which is related actually to adrenals and to stress, so it might be something that comes up when people are under stress. But I found that muscle to be a little bit weak. I worked on the points to fix it and it was much better. And it's a muscle that you use it's one of the first muscles to move to bend the knee. So anything where you're starting to do something and bending the knee, it can give bother if that muscle is weak. So the points to fix it are very simple. They're just 1 inch out to the side and 2 inches above the belly button. So I'll just show you those. So it's 1 inch out and 2 inches up. So it's just under the rib cage, and you push in there and just work it gently for maybe about a minute or so in a circular way, and it could be quite sore and tender. And you do that a couple of times a day, and it should help. But there's another point at the back, and I did this one. I found this one even more helpful than the front one. It was quite sore and tender, and it's at the back, and I'll just show there. It's about there. It's almost opposite. It's at the bottom of the rib cage. But an easy way to do that is if you get a ball that's a dog's toy, actually, because it's nice hard solid one, and what you do is you just put it behind your back with the other hand and hold it there, and then if you lean back against the wall, so you just go back and rub it, holding it with one hand, and just hold it like that, and then lean back against the wall and get the pressure on it. And when I did that, I found it was quite sore, and just hold it and rub into it for a few minutes. And I had to do that for about twice a day for about 2 or 3 days, and then the knee was gradually getting better. But it's much better now, and I don't even notice it. I don't even have to think about it anymore, and I don't have to do this every day. It's just for a few days to get the soreness out of it. So that's a tip, and it's worth trying, especially if you have just that little bit of a twingy, achy knee when you first go to do something, and then it improves. But it just, when you're kind of changing, you move and maybe you change position and you move again and it's sore. But it's not sore all the time, but at times, because there's a number of muscles associated with the knee. This is just one of them, and it is also associated with adrenal glands and stress. So by rubbing those points, you will help with stress as well. So it's certainly worth the go for anyone with knee pain, and thanks for watching.